I'm Dr. Chain. I'm your attending physician. What's been going on with you recently?
Do you see my arm? Is this going to scar? I'm supposed to be in a beauty pageant this weekend.
We'll have to look into that. It does look a little rough, but
Look, it's
we
even
could probably...
oozing and everything. What is it?
I'm not sure. Have you been having any other symptoms recently?
Well, I've thrown up probably several times just in the past hour. Quite a bit of diarrhea, too, in my body. Oh, I just feel like I have the flu. It's terrible.
All right. Are you having any muscle aches, pains?
Yes, all over.
All right. Let's see. You said you're throwing up?
Yeah, I just did probably 5 minutes ago.
Have you eaten a lot?
No, I haven't had much of an appetite.
If you feel like you have a fever, I'll have the nurse come in later and make sure you check that. Have you been on any trips or anything recently?
No trips, just camping this past weekend.
You went camping? Where'd you go camping at?
Grayson Highlands.
All right, I'll be right back. We're going to get some blood work going, and then
Okay,
we'll see
please
what's
hurry.
going
This
on.
is really bothering me.
All right. Miss Collins?
Do you know what it is?
We're pretty sure, well, we're narrowing it down. But
What
I
are
need
you
to get some
narrowing it down
blood
to?
work to see what we're looking at,
But
okay?
you don't know what it is yet?
Not yet. I just
I
gotta get
really
some
wish
blood
you guys
work.
would hurry up. Is this going to hurt?
All right, you're gonna feel a little stick.
How much? Oh, that hurts.
That's not bad, is it?
Do you really need all that blood?
Uh-huh, whole thing. All right, I'm pulling it out now. Miss Collins, we're pretty sure we know what you have.
What? What is it?
Have you noticed getting any ticks recently? Noticed pulling any ticks off, especially after your camping trip?
I think there might have been a tick on me Saturday while camping because my friend brushed something off me, but I didn't see what it was.
Because we're pretty sure you have Rocky Mountain spotted fever.
Rocky, what? We don't live in Colorado.
I know, but it's basically comes from a tick. So I think you may have gotten bitten. We're pretty sure that's what you have. Now the
What about
protocol.
this? Is this going to go away?
That'll go away as soon as we start treating you. And the protocol for Rocky Mountain spotted fever is what it's called. Is that we're going to go ahead and treat you before we even get your blood work back, because we don't want it to get any further than that. You've waited a couple days to come in already, so we're going to go ahead and treat you for that, okay?
Well, what if you give me the antibiotics and it doesn't go away? What does it mean? You're wrong?
If it doesn't go away, I'm wrong. But I'm not wrong. Alright, and Miss Collins, this is doxycycline. This is an antibiotic. This will help treat both your symptoms and everything. Just remember that while you're on this, your birth control is ineffective.
Well, I guess I'd have to have sex to get pregnant. My boyfriend left me. We were supposed to go away on the camping trip together, and he just ditched me. So I'm not going to get pregnant. It's okay.
Alright, just making sure. Alright, Miss Collins, we just got your blood work back, and it is for sure you have Rocky Mountain spotted fever. Your blood work came back. You have some decreased platelets, low blood sodium, and elevated liver enzymes. So those are for sure signs. So you most definitely have it, and the antibiotics should already be helping. And in a couple hours, everything should start working out. So, do you have any questions for me, Miss Collins?
Just if you could tell me what Rocky Mountain spider fever is. That's not what it is.
It's okay.
Spider fever. It's spotted.
It's okay, man. You're a little dehydrated right now from all your diarrhea and vomiting. It's Rocky Mountain spotted fever.
Oh, okay.
And like I told you, it comes from ticks. So basically, the tick was infected, and it bit you, and it must have stayed on you for about 6 hours before you noticed, because that's the time it takes for the tick to actually get in your bloodstream, get the infection. And it's actually caused by bacteria. It's called, forgive me if I pronounce this wrong, it's Rickettsia rickettsii. And
Rickettsia what?
you and me both. Rickettsia rickettsii. I know it's called Rocky Mountain spotted fever, but it's actually very common in these areas in Virginia all the way from Delaware to Florida. These are the most common areas it's at. It most commonly comes from the American dog tick. So especially if you had dogs around with you, they most
No, there weren't any dogs.
Anyways, but not all those dog ticks have it. Only about 4% of American dog ticks.
Dog ticks?
Yes.
That's a word? What is that?
It's just a tick that an American dog carries.
Okay.
And but there's only about 4% chance that the tick has it, and that just happened to be the one that you have. You also could have gotten it from a scrape or a cut, and then the same germ, Rickettsia rickettsii, getting inside that and infecting you. So basically, this will be pretty easy to treat with the antibiotic. We're glad you came in as soon as you did because you have to treat immediately for it to be effective.
I'm really worried. Do you think this can happen again?
Actually, the likability of that happening again is very low. You generally won't get the same organism twice, but you still need to keep good tick skin care. Watch for ticks every time you go out, especially when you go camping. You need to make sure you come home, have your friend or family inspect for ticks.
Like party.
Yes. And because there's many of other diseases that can come through ticks, not just this one. This is just the most common one, especially in this area. So,
Okay. Well, thank you, Dr. Chang.
you're welcome. So how are you doing, Miss Collins?
I'm doing great, Dr. Chang. Look, it pretty much left.
Oh, wow. Do you still having diarrhea or vomiting or anything?
No, the antibiotics really helped. What was it you gave me?
It's called doxycycline. It's an antibiotic, and that's really the only treatment, basically, for Rocky Mountain spotted fever. And you'll keep taking that. Make sure you take the entire thing.
Why do I need to take the entire thing?
Antibiotics aren't effective unless you take the full dose. So it's very important you take the whole thing.
Oh, okay.
So Rocky Mountain spotted fever, it actually originally came from the Rocky Mountain area, and that was before the 1930s. Then about the 1930s, it actually came over and started migrating over into basically every other state. Every other state has had it except for Hawaii, Vermont, and Maine. It's from Canada all the way to South America. It's all over the place, but very common in the East Coast. And ever since 1986, 1990, it's been completely almost gone from the Rocky Mountain area, completely in this area. My opinion on this disease is that it will not ever fully go away. It's always, well, it's possible it might go away because it's very uncommon in most American dog ticks, but it is very easy to keep from getting as long as we practice good tick prevention and watch our skin and just be conscious of all our symptoms, if we get cuts or tick bites, make sure we go to the doctors immediately because they all demand immediate treatment. But this is something that very easily could be contained and should never be a big problem in our community.